Good afternoon, everyone. Welcome to the last lecture of the Department of Architecture Fall 2020 Lecture Series and the Institute of Health and Wellness Grand Rounds Lecture Series. I'm Hui Cai, Associate Professor and Associate Director at the Institute of Health and Wellness Design. 2020 has certainly been a very challenging year that has transformed every aspect of our life, and including the practice of architecture. We are at the crossroad, and it's a critical time to rethink the future of architecture. Today, we are honored to have invited an impressive panel of speakers to give us different perspectives to rethink and reimagine the future of architecture. Now, I'm gonna ask Professor Frank Zilm to make the introduction. Before the lecture start, I would also like to talk a little bit about the logistic for the lecture. So the speakers will spend about an hour to share their presentations. And after Phil's presentation, we will do a poll everywhere. So students need to input your response using your cell phone. Send a text to a number, which you will see soon in the slides. And then after all speakers give their talk, we will have about an hour discussion follow that. And students are encouraged to post questions in the question and answer box, and we'll pick up the question at the end of the presentation. Now I'll hand over to Frank to make the introduction.
Thank you, Professor Cai, and I wish we were all in the forum seeing each other and enjoying life in Lawrence, but unfortunately we can't do that. But we are very excited about this last in our series of Grand Round lectures for this session. And what I'd like to do is give a very brief introduction of our three main speakers. Our first speaker will be Phil Bernstein, who's an Associate Dean at Yale University. And Wei, if you could advance the slide, I'd appreciate it. There we go. Thank you. Some of you may have seen his recent articles in a number of major national architectural magazines, but Phil has been a principal with Caesar Pelli and Architects, and then from there was vice president at Autodesk, where he was responsible for the company's future vision and strategy for BIM technology. He has authored a number of books and articles. One is Architecture Design, Data Practice, Competency in an Era of Computation, and is co-editor of Building in the Future, Recasting Labor in Architecture. And I will invite each of the speakers to elaborate if they would like on their careers. So in our coast-to-coast presentation, we're going from the Atlantic to the Pacific. And our next speaker will be Heather Chung, who's Vice President and Studio Leader for Healthcare Design at the SmithGroup in San Francisco. The SmithGroup representing a large multi-office national operation. She's been involved in facility strategy, systems analysis and research and analytical modeling. Heather has been active in the design of communities for nearly 20 years and in healthcare for about a decade now. She's a LEED certified planner and is an EDAC certified by the Center for Healthcare Design. And then our final speaker this afternoon is going to be someone that may be familiar to you, Rick Embers. Rick is a principal with Pulse Design Group, which is a very strong mid-sized firm based in Kansas City. You may also remember that Rick was the 2019 recipient of the school Distinguished Alumni Award. Rick is a 1988 graduate of the school and has been a strong supporter, and we really appreciate his help with Health and Wellness design. He heads Pulse Design Group, a full-service architectural firm with 40 years of experience in healthcare design and a true passion for healthcare community. Since 2015, the firm has grown from 22 to 38 employees, and Rick has stood at the forefront of this company growth. So we're very pleased to have all of you presenting today and look forward to your input. So Phil, I think we're gonna start with you.
Okay, great. Thank you, everyone. Appreciate the opportunity to speak today. I was excited when Professor Zilm reached out to make this invitation to kind of see what was happening at KU. This PowerPoint is taking on a life of its own. Can I get control, Wei? Because I don't think I have it right now. Oh, there we go. I just want to go backwards. There we go. Okay. Because I practiced for about 20 years before I made a career switch to the technology world, and then I'm in my third career as a full-time academic now. But I did spend quite a bit of my time when I was practicing doing healthcare work. I worked at the Mayo, worked on a building at the Mayo Clinic, did several buildings at the Cleveland Clinic, and have always been interested in those kinds of questions. So I want to start out a conversation today exploring three big questions: technology and how technology is going to affect our work as architects, how that changes the methods that we use to plug into the systems for how buildings get delivered, and then ultimately what that means for the value propositions that we have as professionals. And while I won't be focused specifically on healthcare architecture, in the healthcare realm, which is so technical and so driven toward technical performance and outcomes, I hope you'll find some of this conversation useful. Now, I've been working on and writing about and thinking about this question of technology in the building industry for quite a long time, and I've managed to boil the entire history of technology in the building industry down to one slide. It took a while. It used to be about 40 slides, now it's one. But one way you can look at the history of technology in our profession is as follows. For several thousand years, we drew things on pieces of paper, and pieces of paper were ways of abstracting a very big, complicated thing like a building onto a very small, inexpensive thing like a piece of paper. My friend and former faculty colleague, Mario Carpo, who studies the history of design representation, describes drawing as a CPU strategy. Drawing is actually an extremely efficient way to process a lot of information cycles and get them down quickly in a notation that represents a bunch of stuff. So we did that for several thousand years. Then we had maybe 20 to 25 years of what I'll call the era of CAD, where we took all those techniques that we had learned drawing and we started using computers to make the same drawings. We essentially electrified or automated the drawing process, got some extra capabilities from that around precision and plotting. But we didn't really have a big shift in the representational strategy. In other words, the way we build information to move it around the building enterprise until the era of building information modeling started in the early 2000s. Around 2004 is when it began to become a topic of some discussion, and then lots of adoption through the second decade of the 21st century. But what I'd like to argue for you today is that we're actually entering into a third realm, and it's the realm I'm going to call integrated digital delivery. And it's a realm in which a lot of the building enterprise is starting to become digitized across the supply chain, and that we're starting to look at new ways of organizing and executing projects based on the fact that projects can now be driven by technology that is supported by essentially by the cloud being a place where infinite amounts of storage and infinite amounts of processing power give us a tremendous amount of potency to make a lot of interesting things happen in the building industry enterprise. And you're starting to see a lot of those things happening. This is a report by our colleagues in the UK from the National Building Service, who talked about the emergence of a bunch of different kinds of processes that they're starting to see that are outside of the traditional design representation problem. Things like doing digital twins, creating digital assets, doing whole life cost analysis. The individual issues here are not so important. What are interesting, however, is this idea that there's all this digital information sloshing around in the building enterprise. And so when I wrote my book a couple of years ago, I talked about the obvious opportunity of the digitization of the building industry as one where, and if you follow technology in the building industry, we've all seen a million diagrams that look like this, where your building information model is an information infrastructure that supports design, construction, and building operation, and somehow is supposed to be the kind of master organizer of that whole enterprise, making the information easily accessible and transmittable, then also creating a knowledge structure by which design can inform construction, construction can inform building operation, and then you have this kind of self-reinforcing loop. But what's actually happened in reality is BIM is more of a concept than an actual platform. And what's starting to happen out there is you're getting lots of tools purpose-built for the parts of the process that they're designed for. So you have conceptual BIM with tools like Rhino and SketchUp. You have design BIM, which might be in 3D tools like AutoCAD or early Revit. You have production BIM, which is the creation of working drawings, which might be Revit. And of course, these things are all surrounded by all kinds of adjacent supporting tools, analytical platforms, data sharing tools, Excel, Microsoft Word. And then the contractors have their own BIM, right? They use Navisworks, they use other kinds of tools that are being produced out there. And then you're also starting to see the emergence of what I'm going to call operational BIM, which is a whole series of tools that aggregate data from building sensors or allow our clients, the owners, to manage their buildings. And so what's really happened in that context is you don't have one big concept of BIM, you have a bunch of little BIMs floating around out there that really aren't particularly well related to one another. And now there's this other topic starting to emerge called the digital twin, which I don't even know what that is, but it's some kind of assertion that you can take information from this process and create a digital representation of the building. But really what we're still looking for this concept that I'm going to call big BIM, which is a consolidated view of everything that's happening in this technological continuum. And the way to look at that problem is in the context of the emergence of 5 different technologies beyond BIM. So BIM if BIM is the informational and epistemological basis of this idea, then there's starting to be that does simulation and analysis. I think Heather will talk a little bit about that. There are tools out there that manage data through the platform. There are tools that allow you to memorialize processes through scripting, tools like Grasshopper and Dynamo. And now there's starting to be the emergence of a new generation of tools, a combination of all these things where computers are using all of this data and learning how to do things themselves. And we'll talk a little bit more about that in a minute. And so what I would argue is if you look at that constellation of technologies, modeling, analysis, management, scripting, and machine learning, you begin to see a real concept of a digital twin, because each of these tools begins to play a role in the process of organizing all the information and doing all the different jobs we need to make this large, coherent blob of information useful to the entire enterprise, where modular representation and analytical algorithms evaluate the information that's in that representation. Data management tools let you move data through the enterprise. Generative design tools create protocols that let you organize and use that data. And machine learning data can somehow draw connections. Machine learning strategies draw connections between all these disparate operations. And so what that does is it puts us on the precipice of a very interesting moment in the AEC industry, where we can actually get to integrated strategies. We can begin to break down the barriers between design, construction, and building operation in a more intelligent way. And I'm doing some research with my colleague, Renee Chang, who's the Dean at the University of Washington, where we're starting to study the emergence of these integrated ideas in the building industry supply chain. We've made a list of about 60 US companies that do something across those barriers, something between either clients who are designing or designers who are building, or builders who are making products, or builders who are designing. That our research is not complete now, but what you're starting to see is, because of the power of this information infrastructure, you're starting to see all these kinds of integrated strategies begin to emerge. So for example, on the left, this is Mace Construction in the UK. They have this thing they call the factory floor, which is basically a big gizmo that they bring out onto the site, and then they slip form and construct floors, floor by floors, moving up, requiring them to think about construction as a manufacturing problem. And you're starting to see digital information creating opportunities to integrate process across the continuum of the supply chain. And this calls into question what the role of architects is supposed to be in this continuum, where the barrier conditions between the different players are starting to change. And what I would argue is, as a profession, no matter what sector of the market you're working in, we have to now start re-examining the fundamental value proposition of what it means to practice architecture. I mean, your licensing, your route to licensure is, from society's point of view, has one purpose. Your job is to protect the public's health and safety. And we have a very narrow definition of that right now. But I would argue that given this information complex that's beginning to emerge and the new opportunities of these integrated delivery ideas that can jump from that information complex, we got to re-examine the definition of health, safety, and welfare. And there's a bunch of different issues where that becomes possible. One of them is climate change, where we have to be responsible for the relationship between our projects and carbon. This is an analysis platform built in collaboration between Autodesk and Kieran Timberlake Architects that evaluates the carbon content, the embodied carbon in a project during its conceptual design phase. So it allows you to anticipate early in the process how much carbon might be embodied in your project. If you take that thesis even further, this is some work by my colleague, Alan Organsky of Gray Organsky Architects, who's a faculty colleague. Alan and his firm, which is a design build firm called Gray Organsky Architecture, they work on the circular carbon economy. They design buildings that they believe operate as carbon storage devices by taking the carbon that's been stored in forests and storing that carbon in buildings itself. And what's, I mean, there could be a whole lecture about Alan's work, which is fascinating, but what he really looks at is what is his building's relationship to the overall cycle of carbon in the ecosystem, and how does that drive his choice of design strategy, material suppliers, and so forth. This is how I spent my summer working on architecture as epidemiology. The picture on the left there is Rudolph Hall, which is the Paul Rudolph building, and the Charles Gwathmey building that we work in here at Yale. And I spent the summer with a team of architects, engineers, and planners trying to figure out how to run this building during a pandemic. And suddenly, as architects, we've become experts in social distancing, sequencing, cleaning protocols, air handling, and I may have seen my last pandemic, but you people have not seen this pandemic. And so protecting the public's health and safety, it becomes defined in a different kind of way. And at the same time, there's a whole sort of social justice movement happening around Black Lives Matter and other kinds of social justice questions, where the built environment plays a large part. The built environment instantiates the systems of capital that create social justice problems. And we as architects are going to have to expand our remit to begin to think about those kinds of questions in different sorts of ways. One of the ways that I'm doing that myself right now is I'm teaching this course here at the School of Architecture with my colleague Lou DeBaca. Lou was the Obama administration's ambassador for modern slavery. And we're teaching this course called Fighting Slavery in the Building Supply Chain. We're looking at how decisions that you make as an architect to affect slave laborers in the building supply chain. And I use this diagram with our students to explain, without getting into too much detail, how your decision as working with your client to make a steel building enslaves a man in the rainforests of Brazil who's cutting down trees that create the charcoal that go in the smelters that supply the pig iron to your steel fabricator who eventually erects it in your building. And what responsibility do you have as an architect who's at the head of the supply chain in understanding these kinds of questions? It's been a really interesting course. And then of course we get to our sort of basic responsibilities for fire and life safety. This is the Grenfell fire in the UK, which was a failure of the supply chain, and particularly a failure of the responsible designers, clients, fabricators, and contractors to protect the people who lived in this apartment building. 85 people were killed in this building because the building enclosure system was misdetailed. And it was not, there was no one source of responsibility here. It was a failure in the relationships between the players. And we're going to have to figure out, at least in my view, as architects, how we feel about that and what our relationship is to that problem. And I think this is a particularly germane question for the following reason. Right now, our value proposition as designers is based on this idea that we protect the public's health and safety, and the lens through which that is interpreted is fire and life safety. And I can tell you, ladies and gentlemen, that within the first decade of your career, most of that work is going to be automated by computers. This is a company called Upcodes that takes a Revit model and does all the code analysis automatically. When you're no longer necessary to do fire and life safety analysis, you better have a different value proposition. And as the profession of architecture needs to start thinking about questions of how the automation of knowledge work by computers is going to change the nature of our professions. This is one of two books that I strongly recommend, written by this guy, Daniel Susskind, and his dad, Richard, called The Future of the Professions, where he essentially argues back in 2014 that automation of knowledge work is going to make professionals unnecessary. That what professionals do is make decisions and hoard knowledge. And with machine learning and the internet, you don't need professionals to do either of those things. And so the value proposition of what we do and the definition of the public's health and safety, at least in my view, has to be different. And you're starting to see early examples of this. This is back when WeWork was doing a lot of building, they used their machine learning algorithms to write the programs for their projects. Because it turns out machine learning algorithms, based on all the data that they collect of their users working in those office spaces, turns out to be a better predictor of how the office space gets used than human designers making the same set of decisions. The graph on the left was their design team's prediction about the use of the occupancy use of conference rooms in their office complexes. And the prediction by the computer is the one on the right. And it is far more accurate. And guys, this is not rocket science. This is just figuring out how big your conference room needs to be. But computers do a much better job at that sort of thing. In fact, what computers are really good at is measuring things, simulating things, and predicting things. And if that's the case, then we actually have an opportunity for a different kind of value proposition, because large parts of the building industry are going to get automated. So let's talk about not the design side, but the construction side. This is a study that was done by the Autodesk Chief Technology Office, looking at using a machine learning algorithm and a robot. And this robot taught itself how to build stuff out of Legos. So by doing millions and millions of iterations, this robot ultimately figured out how to assemble things by Legos. Nobody taught it anything except how to pick up a Lego and how to snap a Lego together. And so what this means is these machine learning algorithms that I'm talking about are not only going to be moving the design process forward, they're also going to be moving a data-driven construction process forward. And if that's the case, and in fact, these algorithms begin to exercise their judgment on the construction side of things, this is a project that Autodesk Research is working on to use construction administration data like RFIs, change orders, field reports, field photographs, to try to anticipate where there are going to be construction problems in the field. That used to be your job as the architect, to walk through the job and use your judgment about where there might be problems. Now there's an algorithm that's out there to do this. So what it boils down to ultimately, I think, is a decision we have to make as a profession about what we want to do for value. And Victoria Beach, who used to teach pro practice at Harvard, made an interesting observation in the Handbook of Professional Practice recently, where she said, expecting an architect to design a safe structure is like expecting a chef to cook a safe meal. It is at once a highly ethical requirement and a very low expectation. Aesthetics, and I would define aesthetics here as exercising broad judgment, may be the key to unlocking the real authority of architects and architecture to shape society. We can argue whether it's aesthetics or problem solving, but it's clear that much of the run rate work of what we're doing in the profession may be there are opportunities and challenges of this digitization that's happening here. And there is a temptation, particularly amongst architects, and frankly amongst architects of my generation, old baby boomers, I don't know how old Rick and Heather are, but I'm definitely an old baby boomer to say, this is never going to happen. Computers can't do the things that architects do. Well, in Susskind's second book, where he talks about how tasks, jobs are going to be eliminated by computers, he says the temptation is to say because machines cannot reason like us, they can never exercise judgment. Because they can't think like us, they will never exercise creativity. Because they cannot feel like us, they will never be empathetic. And all that may be right, but it fails to recognize that machines still might be able to carry out tasks that require empathy, judgment, or creativity when done by a human being by doing them in some entirely, other fashion. And if that is in fact the case, and the results are the same, then we have to start thinking a little bit about how we're going to change our attack on this problem. And so in my book, I made 3 arguments along these lines. I argued that we have to re-examine the agency of architects in the system of delivery. What is our role relative to builders and to our clients? And if we're going to re-examine that agency, we have to look again at our methods and start challenging the precepts that say, all we do is define design intent and somebody else does everything else. And if we're going to do both of those things, we have an opportunity to change the value proposition. In other words, the value that we bring to the overall AEC process. And what I suggested in my book, was something that we've been exploring in this course I teach in the spring called Exploring New Value Propositions for Design Practice. And I think some of the students on the line here may have read an article about this course where I asked my students to design new businesses that do not follow the traditional fee structures of architecture, that find some other way to deliver value. And that those other ways might be doing design work in a different way, having a different relationship to the players in the supply chain, providing services that architects don't traditionally support, or making connections between the different parts of the overall supply chain. But what's important about that set of ideas is that, or what I try to acknowledge in this course is, design ideas in and of themselves don't have value unless they plug into a discussion of the delivery systems and the business models of architecture, that there has to be a conversion of value. Otherwise, we're just doing stuff and not getting paid for it. And so what I suggest in my book is that there's a strategy that you might think about to attack this problem. If we're entering into an integrated complex of delivery where there's lots of data out there, then what we need to do is start getting into the outcomes business. Clients do not build buildings to spend money. They do not build buildings to meet schedules. They build buildings to do stuff. And that the stuff that they do and accomplishing the stuff that they do is actually a value proposition. And what I talk about in my book is this idea that there are very low-level outcomes that are what I call transactional outcomes of the process, making the process of design and construction more efficient at the bottom of this value pyramid. But at the top of this value pyramid is what I'll call an aspirational set of outcomes, which is correlating our projects to why our clients build buildings in the first place. And here's a way that you might look at that. This is a chart that I use with my students where I basically argue that the x-axis here is climbing my pyramid from low-level outcomes to high-level outcomes. The y-axis is how many players in the AEC process do you need to make this happen? And there are 4 levels of output here, 4 levels of value creation, but the left 2 are relatively low value, which is why you see that curve sloping up. But the right 2 are high value. And so if you want to work by yourself and just do a better job, that's what I call a transactional output. You meet the brief, you meet the design schedule, you meet the level of quality that your client's looking for, and you don't really need any help to do that. If you're going to help the overall delivery of the design and the building, you have to work with your contractor. And if you can work more closely with your contractor, you can meet construction schedules. You might be able to do a better job with budget conformance. You can get your systems actually operating, not just designed to spec, but operating to spec. And your building might operate at the level of durability that your client was hoping for. But that is what clients expect us to do as architects and our engineers and contractors. We just don't do a great job of it. we don't do a highly predictable job of it. Where it starts to get interesting, of course, is at the next step up in my pyramid here, which is operational outcomes. Saying to a client, this building is going to perform like X. It's going to save this much energy. It's going to reduce carbon. Your staffing is going to be cheaper or more optimized. It's going to be cheaper to maintain this building. Those ideas have two characteristics. One, it's stuff clients want, and two, it's stuff they're willing to pay for. So if you were willing to say to a client, this project is going to save X amount of energy, and you keep 75% of that energy savings, and I'm going to take the other 25%, I've just substantially increased your fee. Right, Heather? I have substantially increased your profit. And then if we were to go to the project performance outcome gymnasium, the CrossFit of outcome-based delivery, and got really good at this, at the end of the rainbow here is what I call aspirational performance, which is why clients build buildings in the first place. They build hospitals to make people healthier. They configure operating suites to lower infection rates. They build retail to make money. They build schools to educate people. We as architects are very fond of saying all of these things are going to happen, and then we plug ourselves into value systems during which we are completely disconnected from that. Our fees are based on commodities and lowest prices, and we sell time, and the time has no value except relative to another architect. And so to kind of close here, I want to suggest to you that, going back to the argument of agency, methodology, and value, that right now as architects, our agency is this thing called defining design intent, which the students have talked about in pro practice. And our methods are about iterating and using our judgment and squirting out fixed deliverables from the process. And fixed deliverables are things like drawings, specs, RFIs, change orders, all transactional stuff. And the related value proposition is commodification. You compete based on lowest first cost. And that there might be a future state where your agency is about a relationship between design intent and construction execution. And your role as an architect is controlling the informational infrastructure that makes all this stuff happen. And that your methodology is still reliant on exercising your judgment, but uses the information infrastructure to systematically explore problems, generate solutions, provide analytical support to your decisions, and tell your clients, I've evaluated this question, I've simulated it, I have a prediction for you, X is going to happen. And then when X happens, you get paid based on an outcome. When X happens, you get paid on an outcome. And this breaks us out of this commoditized, lowest first cost, transactional system that we're in. So I've made a gnarly, complicated argument here that mixes together all kinds of stuff. Social justice meets business models, but I've tried to be, as I was instructed by your faculty, as provocative as possible about what I think the potential future of the profession is. So now what you guys need to do is get out your phones, because we're going to do 3 quick poll everywhere questions just to see if anybody was paying attention. So in this first question, and you can see, put that link up there, that poll everywhere link in your phone. Oops. And can I control this thing, or Mike, are you controlling it? Let's clear my previous test response. And just start typing in some words that you think, why do you think the value of architecture is underappreciated? Just a word or a phrase. And we'll take about a minute or so to wait for your responses. I know every single one of you has got a cell phone on your desk, so take it out and punch in an answer. And Rick, go ahead, man. Anybody's free to answer this thing. Anybody out there? How many responses do we have? Wait, I can't quite read that. There we go. Well, there's one. Poor marketing, yeah. No, this is great. I love this. All right, we're going to give it another 20 seconds. Capitalism, that's an interesting one. Okay, good. So I find that interesting. I'm assuming that what you guys meant by saying time is that we're selling time instead of value. And some of these other thoughts are really, really interesting. Wait, let's make sure we capture that answer because I think it's pretty cool. All right, so next question. If I can make the slide advance. Okay, so if you're listening to me, you just heard an argument that our system needs massive disruption from your generation. Is your education helping you do that or not? So 75% of you are in the fat middle of the curve here, saying somewhat valuable. Be interested during the Q&A session to find out what is the value of that. And there is an argument that says we should be training you people as architects not to disrupt anything because we want you to go into the existing systems. So needless to say, that's not my attitude. All right, now here's one of my favorite questions that I always ask my students. In 10 years, do you see yourself in a traditional practice? And if you don't see yourself in a traditional practice, think a little bit about what that non-traditional practice might be. Okay, so just to be totally clear, Frank, 80% of your students just said that they're not going to be in a traditional practice. And there are not too many healthcare firms out there that don't consider themselves traditional practices. So there's some kind of cognitive dissonance going on here. Let's find out what it is. Okay, the 80% of you who said you weren't going to be in traditional practice, what do you wish you're going to be doing 10 years from now? Design build, I assume that, yeah, it must be design build. Okay, what else? Okay, on the back end, research. The word clue there is pretty interesting. Furniture design, actually doing healthcare, historic renovation, flipping projects. Interesting. Government, being in government. Somebody said video game design. That's pretty interesting. Keep going. Post-occupancy evaluation, systems development. This is very, very interesting. Very interesting. Okay, so as we go on to our next two speakers, keep some of these thoughts in mind as they describe to you how they're thinking about the future of the profession. And with that, I cede control. That's how you can reach me if you want to. With that, I cede control to Heather. Oops. I think you got to go back one, Heather. Sorry.
Is that... Hello? Can you hear me? Someone give me a thumbs up.
Yeah.
Coming in loud and clear.
Thank you, Hui. Frank, just to let you know, you're still on no camera. Okay. Thanks, Phil. That was quite a setup there. I feel kind of already like dinosaur-esque and outdated, but I'll continue on because actually I do feel that designers or people that are in the field of design have a certain kind of passion and a drive to see things different in their environment. And whether it's part of an architectural practice or whether it's part of another type of industry, the ability to envision something different around you and make it happen is a really special gift. And I want to make sure that everyone, no matter what they do, whether it's furniture design or go into medicine, kind of preserve that. So with that being said, I'm going to jump right in. Let's see if I can. Oh, I can't shift. Oh, I'm going backwards. Am I supposed to?
Yeah, feel free to use any of my slides you want, Heather. Yeah, you just click in the middle of the image and click your right arrow. That should do it. Oops.
Oh.
Oh, now you're into Professor Kai's email. There you go.
Oh, shoot.
There you go.
Okay, here we go. Let's go. So, gosh, I'm still having problems. Why could you, excuse me, could you advance the first slide? Maybe that'll kind of kick it into gear. So anyway, I'm really honored to be here representing SmithGroup, our health practice, and also representing all the people that are really passionate about healthcare out there in the design community, along with Richard. I've been with SmithGroup for about 15 years. I started in their healthcare planning and programming group, and now I lead the healthcare studio in San Francisco. Out of the 240 people across the country dedicated to healthcare in SmithGroup, about 80 of them actually reside in San Francisco as part of our studio. So just I just give a little background on SmithGroup. You know, I've been there for 15 years. Our firm actually has roots that are technically, I like to joke, as older than sliced bread. It's been around since 1853, and it's not that so much that we're classic, but I think it has a lot to do with the core values that you see here in the center of the screen around passion, around really trying to create a sustainable, equitable world. And there's a natural curiosity and integrity about the work that we do. Sorry, trying to shift slides here. I only included a slide only just because to set up our discussion around scale. Frank wanted to just kind of give a point and counterpoint to what it means to be big versus a small firm. And so here's just some of our stats. We are pretty big at about 1,300 people spread across 15 offices nationally and as well as in China. But we're not the biggest. We are a full service architectural engineering firm. And you see along the bottom is some of the markets. We call them practices within SmithGroup, and healthcare being one of the largest. Okay, let's click. Shoot. Wait, do you mind if I just ask you maybe to forward the slides? I can't seem to get it to work. Okay, there's a whole lot of disciplines also that are incorporated into our firm that help serve the wide variety of projects and project types and clients that we have. The next slide. And then here's just a glimmer of the whole spectrum of healthcare project types that we work on within our healthcare practice, including and crossing over into aging environments, which kind of crosses over into residential. So I'm going to click. So here's where we can get into some good stuff. The rest of my presentation is really, I've divided into two sections. One that's looking more upstream about things that are really impacting the future of health. And then looking downstream, observations about what that means to the future of our profession and what that means in terms of how we're going to ultimately, what we're looking at in terms of how we're going to evolve into another kind of organization looking into the future. So next slide. Thank you. So, you know, I'm just going to take us back a year because just to kind of get back into the framework of what healthcare was about and I think continues to be about. Here's a few of the headlines that were emerging last year around new technologies, new business models, different partnerships that were emerging, all responding to all the overwhelming constellation of needs around healthcare. Click. Next slide. You know, a way to frame the strategic decisions and questions that are facing healthcare is to really build out a map around the drivers of change. And this is using kind of a STEEP model, which is looking at all the social, technology, the economic, environmental, as well as the political factors that really go into setting a context around what any kind of industry needs to think about, react to, anticipate, maybe safeguard against. Next slide. And out of all of these, and you'll see actually, this was an exercise we did about 5 years ago, a version of it. And you'll see that we kind of flagged that wildcard virus out there. But really, again, all that context really sets up the why. The why about why there's certain approaches that we have in terms of healthcare design, or the things that we think about in terms of what it means to provide healthcare, the priorities and areas of focus that are emerging and continue to emerge. One of the three, before I go to the next slide, one of the three takeaways that for me is really around healthcare and why designing for healthcare is very distinct is, you can see kind of, if you read between all of these messages, first, healthcare is expensive. Healthcare is both expensive to build and to operate, and will always look for the most efficient way and cost-effective way to be able to provide the care that's required. In 2019, the United States essentially we were spending about $11,000 per person per year on healthcare, and that's the highest healthcare cost per capita across the globe. The next highest is Switzerland, around $8,000 per person per year. So again, the reasons why and how to kind of get our healthcare costs in line is something that's ever present. The second takeaway I'm always thinking about is healthcare always changes. Not only if you see this map of drivers of change, there's always new therapies, new technologies, new operational models that not only have a real impact on people's lives, but also on the work that happens in those environments every day that demand a high level of strategic choices, as well as targeted flexibility. And all that while essentially our buildings want to stay the same. And then the last piece is that healthcare is distinctly human. If you've sat in a gown in an exam room, if you've waited in ED with someone, you know that design has an impact on your human experience. And our designs have impacts on providers' effectiveness, on not only families, but essentially communities at large about how they feel about their health and their investment in health. So just when I thought there was no end to the wicked problems to solve, wait, so let me see if I can try to, let's see if it'll work for me now. Let's see, I'll try this. Okay. The last 8 months really brought into clear clarity kind of some of the things out of all of those things are going to be really most important looking into the future. But I thought I would just take a moment to talk through some of the observations that we've gathered over the last 8 months, hearing from clients, talking through projects, really looking at what the market is doing in terms of what it means to provide healthcare and what our healthcare clients are facing right now. So this right now essentially, and is kind of also being, was kind of started in April, and also now is kind of where it kind of had settled down, is now refreshed, is this idea of essentially focus on really management of resources, really how to try to make sure that they're maintain operations, and on the backside that they're looking at their costs to see in a way that's like a financial recovery mode. There's a huge, enormous amount of uncertainty about how the pandemic, how it's going to last, how it's going to end. That may have changed a little bit with Pfizer's announcement yesterday around the vaccine. But again, this is going to have a huge impact on healthcare and the healthcare industry in terms of moving forward. The American Hospital Association estimated the healthcare system will likely lose about $323 billion just in 2020. And that will have a huge impact on what they think they can do in the future, especially for us as designers, looking at the future in terms of how they invest their capital. What we're seeing is that they end up, either they're trying to push out or flatten the curve in terms of that capital spend on those large scale investments, or they're trying to front load projects that they think that can provide immediate revenues for them in the near term. They're also looking at ways, our clients are looking at ways to look at other purchasing models that can use other people's money to provide the care and the care environments that they need. So we're seeing a lot of activity in the P3 capital market. Looking into the near term in terms of projects and what kind of work might be coming, what healthcare providers may be looking at. They are looking at ways to kind of restore revenue. So ways that they can support maybe potentially having COVID or non-COVID operations working simultaneously to try to make up for some of those lost revenues over this last year. So what you saw, like kind of after the spring and through the summer, you started to see some of the ambulatory centers kind of opening up, providing care, providing segregated areas or different facilities for different types of things, really trying to really focus on defining how to create a facility that would make sure that people felt safe and that operations were maintained to be safe. And that was really, again, all around trying to reintroduce some of the revenues that they lost in this last year. Let's see, so the next slide. When we're talking about looking far into the future for healthcare providers, you know, as I was showing you last year, I mean, there's a lot of consolidation that the healthcare industry is going through. And actually in the pandemic, there was a lot of benefits that systems and enterprises that had multiple different entities found that they were able to be flexible and agile in terms of being able to respond to the pandemic and those kind of situations. And so again, consolidation will continue to continue moving forward. They'll probably want to look at, when we look at what they want to do in the future, is really kind of looking at the innovations and any adopted processes that they were able to accelerate during the pandemic, especially those that improve efficiency and reduce cost. So again, all the telehealth components where they're finding opportunities where they can leverage resources better, areas where they can actually really have people stay at home and be able to remote monitor them or to provide care in their home without having to have them travel back and forth to sites, as well as opportunities to see if there's ways that people can stay off-site and stay at home and eliminate costs related to having them come and provide facilities for them. Another thing that they're looking at in terms of kind of long-term planning is how to kind of move forward with initiatives that expanded care, that really looked at how they could optimize that healthcare dollar and really help manage the business risks around what it means to be a healthcare provider. So looking at how to do work more effectively with less resources, having people work at their highest license, as well as looking at the new workforce and maybe looking at what are the kind of key traits that they need to have in the next generation physicians. I touched a little bit on maybe there's some capabilities that can be expanded, providing acute care at home. And then also there's just been a lot of emphasis on how to provide better primary care, more expansive access to care, as well as more extensive behavioral health services. One thing that kind of also has come out of the pandemic and some of the insights was this, and it's not only just in healthcare, but across the spectrum, is this the importance of that technology backbone. And what we see is looking into the future that there'll be a lot more investment in making in infrastructure to make sure that that technology backbone can really support that large scale data sharing and analytics, as well as really be there in a disaster response. There's several, couple facilities that we knew that actually once the disaster hit and everyone went remote, that they had some really major infrastructure issues and was not able to get the continuity that they need. And they had to actually provide some other types of facilities or partner with other facilities to be able to get to kind of resume the services levels that they needed to. Let's see if I can go. And then just big picture questions and disruptors and rule changers. And Phil kind of alluded to some of these. But the first one off the top was in the pandemic, it really did show major weaknesses in the system. You know, at the peak of the pandemic, everyone was struggling not only to identify respirators in areas where there was a huge surge, and masks were always also in desperate need, but even like minor things like cotton swabs and paper towels and things like that. And so really there's an opportunity for that kind of supply chain and logistics infrastructure to really be looking at kind of reestablishing that confidence for healthcare providers to know that they'll have the supplies and have the operations to be able to support kind of a disaster response. There's always that, as Phil was talking about, just in our industry, but also in healthcare industry, looking at those technologies that are going to replace human capital. There was a lot that was done with robotics. There was a lot done where people, where actually it was safer to have robots in environments versus in clinical environments. And so to the extent that they'll want to preserve those and they've made the investment, that's what they'll really want to kind of think through. But when it comes to AI and other types of things, they also see other opportunities where they really could use those investments in those technologies. The government, obviously the election has a huge role in what may happen in the future, but really understanding what their role and responsibility is in a disaster response is going to be another game changer in terms of what they how healthcare providers need to prepare for the future. And then then there's some big picture strategic questions around what they do with their facilities. Do we build more capacity? Do we build a higher level of capacity? Do we build more flexibly? And where would we target that flexibility? Or are we really building other things? I think I shared with you the whole spectrum of healthcare environments that right now we're building, but actually I have a feeling that 1/3 of those are going to fall away and that we replaced by a whole another third of environments that I think as healthcare designers, we're going to want to invest in and think about and design for. The last one I kind of wanted to end on is the human and social fallout. So, according to a recent count by the CDC, about 170,000 healthcare workers now have contracted COVID. And actually, some estimates say about 750 to maybe more than 1,000 people care providers have died from COVID. Those are numbers that are going to have a huge impact in terms of not only people that are out there able to provide care looking into the future, but people thinking about really whether to go into that type of career. So again, the pandemic has also kind of revealed huge disparities in people's health, their access to care, the ability to practice self-care, and to protect their families and their loved ones. So it's been very interesting to see the reactions to the pandemic. Actually, it was pointed out that, even in the politics, when people have attitudes about the pandemic, there's really kind of two different experiences that people across the country have had. And I think here in California, where I'm in San Francisco, and it's a highly dense environment, I have a completely different experience and sensitivity to the risks around the pandemic as compared to people that are completely in rural areas that are able to have outdoor space, that are able to social distance and other ways to keep themselves safe. So again, dealing with that disparity of experience moving forward is going to be important. Okay, so anyway, I wanted to click, it's not working well. So just to quickly jump, there are a series of post-pandemic design responses that have been developed, and I'm sure you guys as KU scholars have been exposed to a lot of the ideas around acuity adaptable rooms, providing spaces for telehealth, all the different infection control measures. The thing that is kind of out there, and I think I alluded to, is the kind of human and social impact and how people are really going to feel safe in the future environment. And so, a few years back, the triple aim that the Institute of Health had put out there as far as what healthcare should really look at in terms of transforming into the future around optimizing population health, looking at how to make the cost of healthcare more efficient and really improving the healthcare experience now is the quadruple aim, which really is, again, not only about patient experience, but incorporates the care team experience. So, oh my God, excuse me. Why are we going backwards? So again, how to make people feel safe, feel confident, feel like when they come into an environment to get care, that it's a meaningful encounter, how to create a space that keeps them present and make sure that they feel as invested as their care providers are in their health as a whole person. So I'm gonna shift here.
Heather, do you want me to have control?
Yeah, could you take control?
Yeah.
Please, thank you. So one of the things that I just put out there is, to be able to kind of imagine the world in where you're addressing some of the bigger picture issues around health equity and what the human experience is going to be like, really requires kind of more of a futures thinking, a speculative approach to design, where we actually create a space where we can kind of think through what would be the options and not use just only our projects to create ideas around design, but actually create a space where we're thinking about the future. So this is, I just throw out there, this is the Voros cone of possibilities. And you can see where in the orange space, these are all the possibilities that you could see happening that are potential and potentially plausible. In that blue cone is if all things were to go as they would normally, that's kind of what's really most probable to happen. But there's an opportunity really, again, and this is where I invoke you guys all as designers and people invested in the future, that we think through and imagine and really take an opportunity and step back to think about where we'd like to go in the future and really think through how we can make that happen. So this next phase, I just wanted to kind of talk about is us as professionals, what kind of things that we need to do to be able to kind of prepare ourselves to be thinking about the future and be able to practice and to make that happen. So thank you. One of the things, I think Frank mentioned I have an MBA. My focus was on strategy and entrepreneurism. And the one thing that I took away from my MBA program was that essentially all industries are ecosystems. There are big fish, small fish, plants, animals, all sorts of things, and everything has a role in it and has a place. There's not one right way of doing anything. Everything has a component in kind of contributing to an overall industry's health and well-being and moving forward. That being said, at any given point when there's something introduced into the ecosystem, like for instance, in a natural ecosystem, if the climate or the temperature of the water should change, everything in that ecosystem, all the entities have to somehow change and evolve. Some will really grow and expand, others will shrink, some may die, some will, totally overpopulate. But again, there are some things that are happening, and I think Dr. Bernstein mentioned some things that already are emerging that are really transforming the ecosystem that we as healthcare professionals or design professionals are dealing with. So again, the idea that data enhanced design and that it's technology enabled ways of interacting with our environment, that there's new building technologies and materials that are coming and emerging that are things that we want to be able to work through. And then there's all sorts of different collaborative delivery models that really kind of blur the silos around where our areas of responsibility are within the building industry, and are really hopefully going to create some more opportunities to do things better in the future. So I just have a few slides just to share kind of what we've been thinking about that. one of the things that a benefit of being a large scale design firm is the fact that we actually not only have a lot of healthcare projects and depth of portfolio to kind of reference and to be able to benchmark, but we also have a number of markets and practices that we can actually reach out to. And as you see, looking into the future, that there is so many hybridized environments, whether, the most obvious one is an academic medical center, but we're dealing with learning environments that are about healthcare. We're dealing with retail environments that want to be able to inform and be healthy. We talk about parks and open spaces and how to introduce components that really respond to some of the healthcare needs and are specific to the demographics of the people that are in those and have access to those open spaces. So we're finding a lot of really great opportunities to cross-pollinate with some of our other practices and really kind of bring the best thinking to bear on how to kind of develop a holistic environment. Next slide. We actually have also been thinking about not only just the kind of different perspectives on the different kinds of environments that we bring in terms of our expertise, but also different kind of disciplines. And this is just an exercise that we did just looking at healthcare planning. And again, those of you that are really interested, if you think about, strategic planning as being kind of the highest upstream, where conventional architecture was about 10 years ago was really focused on kind of campus planning or master planning. And it would kind of move down to programming, where you kind of get more in detail about the space and the requirements. And then there's the medical space planning, where you take those spaces and actually map them out into adjacencies and diagrams. So if you could click next slide or next click. So what we see is actually over the last 5 years and probably a little bit earlier was the idea that there are all these other disciplines, whether it came from financial modeling or data analytics or process engineering or industrial design, that started to inform some of these buckets of activities. And while we were kind of going through and to really understand, and if you could click on the next thing, like there were certain components that had naturally emerged out of our practice that we wanted to incorporate into our design, because as healthcare kind of grew in complexity and the wicked problems that we were trying to address really did try to pull from other different disciplines in terms of knowledge to kind of what was required to solve the problem. And now those things, as you see, we click on the next slide, you'll see that those now are coming out of the unconventional architecture bucket and really kind of integrating more into what I think are part of what we see as an integrated practice moving forward. And that's just healthcare planning. On the design side, we see that computational science, computational specialists, design specialists, we see data analytics or data expertise, as well as we're thinking now, given all the importance of really understanding some of the social inequity issues, that we see the opportunities to bring in anthropologists and sociologists into the work that we do, whether it's through partnerships or whether we actually formally integrate that into our company. Those are all things and opportunities that we're looking at to really address the problems of the future. Next slide. One of the things that I think when I became studio leader, the thing to really, for me to really try to understand what we needed to do in terms of shaping what the work that we did is, I was really influenced by a McKinsey article that really talked about what drove value in organizations. And while there might be formal structures around how people are organized hierarchically, it's really those informal networks in organizations that really get things done. And I really saw that in our studio in terms of being able to, for people to be able to respond quickly. People knew each other and knew who to go to be able to get things like printed out or worked out or figured out very quickly. Or they knew who to go to find out that special knowledge about a pharmacy planning exercise, or they knew also if they had to make a judgment call, who they could trust. And I saw these networks actively kind of in play and was encouraged that actually opportunity to really foster a more networked idea of what an organization should be, was really the path forward to being a much more agile and responsive organization in the future. So as a studio and a studio leader, that's where my emphasis was really to breed community, to breed familiarity, again, to really strengthen those informal networks, which I saw were kind of core to being an agile learning environment for everyone in the studio. If you click here, click on the next slide. And actually, it's interesting because coming out of the book that Phil mentioned, The Future of Professions, there was an examination at the highest level outside of the studio, was looking at, as an organization, how are we really going to try to evolve to respond to the next level of decision making, especially when you think about integrating some of the technologies that may be coming to bear as far as changing what we do and how we do it. And so this was a diagram that one of my colleagues did around the decision-making structure in our firm to really talk about it, moving it from a hierarchical organization to almost a nuclear network that was much more organic, nimble, flexible, and open-ended. The next slide. I wanted to touch a little bit on Van Ness and Geary, that I understand I have 5 minutes. So this is an integrated project delivery, and kind of harkening back to what Phil was talking about, this was an incredible experiment from the very beginning to think about how to design differently and work collaboratively with contractor and owner to develop the highest value project. It's 1.5 million square feet and over $2 billion of $2 million of construction, and integrated some ideas around lean, which I'm sure everybody is very familiar with. But at that point, we were all learning. This was back in 2012, and where we all were distributed the Toyota way, and we all took classes on what it meant to be lean. But it was that lean mindset, as well as some of the other that really allowed us to do some of the innovations that happened on this project. So next slide. There's a tremendous number of reasons why it really did make sense. And it was a lot around risk, around understanding how to minimize the risk to the owner, and really create an environment where there's an alignment between architect and the contractor and GC to really work together to minimize the risk. I'm going to click through real quick here. I can go back if anyone should have any details. The one thing we wanted to make sure was that, there were some, that it wasn't, we really wanted to redefine what the delivery method could be. So you'll see here, this is up above is kind of what would be the standard process of design. And there was a lot of effort to actually completely redefine the terminology around what we were doing. And so the idea of creating a validation phase, which is really developing the criteria for design, which some might say might blur into schematics, but the fact that it was really focused on criteria really redefined for the entire team what we were trying to do. And that went through the entire process. It wasn't about design development and developing contract documents. It was really about what would you need to detail that design and then implement the design. Next slide. And so with that information, you start to think about what our future organization might be. And this is a typical pyramid where a traditional architecture firm, where you have at the highest level senior staff, maybe thought leaders, design leaders, you have kind of mid-career staff, and then you have emerging junior staff. And if you click, and this is somewhat aligned to, again, the work that we're asked to do, schematic design, where you have some of that thought leader kind of setting the direction, the design development, and then you have a lot of staff devoted to the production components of the construction documents. But if you think through, and again, some of the things that Phil brought up, like there's a tremendous amount of what we document that actually might be better documented by the contractors themselves and some of the trades on board. And that's what we found on Van Ness and Geary. You also start to introduce some of the new technologies around building components that actually could also be incorporated, but also take away from the things that we need to do. So you actually start to think it's not really a a pyramid, but actually more of a kind of a rectangle if you look into the future. So if you could click through. So if we really did talk about really aligning our staff mix with the real emerging delivery methods that are out there, talking about going through processes of design development that really support a collaboration between owner and contractor or builder, and really doing a minimum documentation, then you still probably have thought leaders and design leaders that really are setting that criteria. But then as part of the development of design, you have technical people that are doing the research and detailing, people that are doing collaboration and actually focusing on synthesization, because that's something that architects do incredibly well, as well as maybe it's really having specialists that really understand computational design or really automated production tool development. So things that actually can automate the process of documentation. So click next slide. So here's our process moving forward, kind of looking at how we do things. And again, in the pandemic, you'll see these are all these pictures kind of had the assumption that, yes, we're working side by side together. You can click on the next slide. This was how we looked before, and next. This is how we're looking together in terms of our current state. Next. So again, in the—
Heather, we're going a little long here.
Okay. So next. So again, this is all work that we've done. So again, this is where we end. Taking to the next step. And
Great
again,
timing there. Okay. All right. Well, we're going a little bit long. We're scheduled for 2 hours, so we're okay. So we're going to shift over here, and it may cut our time down for questions a little bit at the end, but I think we're in good shape. So Rick, the ball's in your court here. Thank you, Heather.
Okay, well, I had to do it the old-fashioned way. Thank you very much. And Heather and Phil did such a great job. Maybe I can just step out and we're done. Does that sound okay? They pretty much covered everything, I think. Thank you all very much. This is a great opportunity. And thank you, Frank, for asking me to be a part of this. I really enjoyed the prior presentations. A lot of elements that they touch on that we think about all the time, and then some new things that I had not thought of. So we can always learn from our industry. And that's the one thing about it that you should keep in mind for your career. It's a learning process forever. Don't stop learning. If you do, that's the end of it. So with that, I'm not able to change slides. There it is. Let's see if this works. Okay, we're going to skip. Frank did a great job of introducing me earlier, so we're going to skip this. But I am not the Dos Equis man. So I've been, one of my clients when I walked in for the first time said, "Oh, do you sell beer?" And I go, "What are you talking about?" And he thought I was a Dos Equis guy or something. But anyway, moving right along, a little bit about Pulse Design Group. And you have to excuse me, I'm clicking back and forth between two computers here. Technology is always a struggle. A little bit about Pulse Design Group. We started back in 1980, and we're 100% healthcare focused. We made that decision several years ago. We currently are located in the suburbs of Kansas City, Lenexa, Kansas, but we're moving down to the Country Club Plaza in a couple of weeks, and that is a part of our technology problems that we're having today as we're switching some equipment over. But bear with me. It's much better actually than some of the conference calls I have to have with my clients. Usually about this time, I'm yelling at somebody going, "Karen, please turn your phone off. That's why we're getting the echo." And you guys are doing a much better job on the technology side. In addition to providing traditional healthcare or healthcare design, architectural and interior design, we do offer two specialized service lines. And just to give you a little background, on those because there's very definite reasons why we did that. Medical equipment planning, we started that several years ago, and the reason why, we found out that our clients actually do a great job on ordering the day-to-day things for their hospitals, you know, like swabs and gloves and masks and small equipment and refrigerators for those little projects. But they actually, quite frankly, suck at managing equipment for projects. And so what this does is we're trying to solve problems for our clients. So our medical equipment planners actually come in and help the client identify what equipment they need. And they do it up front, they help them budget it, and then they come and tell the design team, okay, here's the list of equipment, here's all the cut sheets for it, and you need to design to these pieces of equipment. So we have a lot of specialized, healthcare is very equipment heavy, if you will. And so we have a lot of special power needs, we have utility needs, med gas, in addition to space requirements and structural requirements to meet that. So we're able to get that information much quicker from our clients. And then we're able to manage the delivery of the equipment to support the actual construction project. So in the past, you would have a project, maybe you're doing a patient wing, and you would finish it, and then you would find out maybe the client forgot to order the beds. Well, that's millions of dollars just sitting there doing nothing. You can't do anything with it. So our equipment planners say, okay, we want the beds on this date, we want the cath lab equipment on this date, and it really helps with the overall process. They actually work more for other firms than they do for us. The other thing is virtual reality. That was also started as kind of a problem solver for our clients. We had a project several years ago where we had a problem. We had a conflict between a surgery light and equipment boom in a cath lab. And so we did what we call an autopsy, and that's where we go back and try to figure out what we did wrong and how we can avoid that in the future. And what we kind of came to the conclusion that we had all these great tools, but they were really mostly in a 2D world. So even working in BIM or Revit, I think we were in Revit at the time, and we really weren't that deep into it. It showed you everything in a 2D world, like on your monitor screen. And we couldn't anticipate some of these problems very well. And when you're looking at the sheets that are given to you by the equipment vendors, it becomes very difficult to see that you might have a problem. So we started down this path, virtual reality, and invested heavily into that. Luckily, technology hit it perfectly at the right time. And also we had acquired some staff that was very interested in it, and it took off from there. So those two items are kind of different for some firms. One unusual fact about Pulse Design Group, in our 40-year history, we have never had a claim or a lawsuit against our firm. And you probably don't quite understand what that means, but for us in the industry, that's very rare. We're kind of like a unicorn or something, I believe, in the industry, it seems like. But our professional liability company loves us, and I think there's some good reasons why that has occurred and that we've kind of followed through over the years. But I'm going to switch to the next slide here. Okay, I'm going to give you some pro tips. There's like 6 pro tips, and if you worked at our office, you'd have to put up with Rick Embers' pro tips every once in a while. And this is one that we've shared with our staff. And it's true. It is absolutely true. People don't typically sue people they like. That's something to keep in mind as you work through your career. You know, you don't want to cause problems for your friends and people you like and things like that. But when you have somebody that you don't really like, you don't really care. If they screwed up, go after them. So that's something to keep in mind. And Allison's on the, I believe, is listening to this, one of the students, and she's probably heard this already, but we'll just have a few of these. Let me change the slide. You'll have to forgive me. That thing changes. Okay. This is very similar to, I think, both of them, Heather and Phil, alluded to know your future, you must know your past. So we're going to give you a little bit of history of how we got to where we are. And having problems all around here. Go to the next slide. Oh, thank you. There's a specialist in there helping me out. There's three things that we think are keys to our past success. And we think these might also be keys to our future success. Our firm size, our smaller size, and we're about at getting close to 38 people, I believe. We have very little bureaucracy. This makes us very nimble, able to quickly respond or adapt to current market trends. Decisions are fairly simple. At most 2 to 4 principals. We'll jump into a room with some key staff members and we have a quick decision and we can move on. Rarely do we spend more than a week on a decision. And, you know, all organizations are different and there's a reason for bureaucracy, but I really appreciate being able to have that quick response and we can move quicker. The other thing is our conservative business practices. This is inherited from the very beginning. We basically live within our means, and we know that many firms borrow money to meet payroll, or they're having to pay building mortgages or a lot of things like that. We are fortunate enough to be in a situation where we never spend money that we don't have, and we kind of do that. The principals kind of self-fund the firm. We don't do any distributions until the following year, until we know the firm is financially on good, solid ground for that next year. So we're basically funding that first couple of months for us. With that, we're going to jump into the next pro tip. This is another thing that you'll hear from Rick if you worked at our firm. But it's true. You can be the very best architect or firm in the world, but if you can't manage your business, it won't do you any good. If you're out of business, you're not practicing. So you have to maintain the business side of everything as you do design. The unfortunate thing, you know, we hear everybody wants to be a principal and things like that. The sad thing about becoming a principal, the more you move up in an organization, usually the less design you do, and especially if you become a principal, you're handling more HR issues, business management type things. I'm not saying it's bad or good, but I'm not doing as much of the things I used to love that when I first started out. And that's something to keep in mind. Next item, I'm going to get into the strategy here. Okay, so over the years, we've had strategic business decisions, and these are just a few. There's a heck of a lot more. So 2008, we've already talked about it. We added medical equipment planning service line. 2009, we switched to 100% healthcare focus. Then we rebranded to Pulse Design Group. We used to have the typical architects' names, you know, Bob, Jim, Frank, whatever. And we decided that we wanted to get away from that. And so I think that's been very beneficial for us. In 2011, we rebranded. We rebranded because we kind of did a survey of our clients. We went through and talked to our industry partners and our clients. How do you see Pulse Design Group, and you know, what can we do different? We quickly realized it was time for a change, both in name and firm culture. So we went through a major rebranding effort, changed our name. We were always known for doing smaller renovation projects and things like that, but we really struggled landing some of the larger high-profile projects, new greenfield site projects, et cetera. So to help resolve this issue, we went out and actively recruited new talent with this type of experience. And then we also put an emphasis on acquiring all the necessary technology, either hardware or software, to support our staff. Next, 2015, we added the virtual reality lab, and this allows us to create near photorealistic and interactive environments for our clients. And they can experience it prior to any construction being done. This obviously can help minimize change orders, improves client and staff buy-in to the design. This was a very successful addition to our firm, and we've done numerous presentations regionally, and then we were also asked to do presentations at the National AIA conference 2 years in a row. So that's been a fun addition to our firm. And our clients seem to really appreciate being able to walk into some of these highly detailed environments before anything is built and making some real-time design decisions. 2017, 2020, don't want to go into too much detail about this, but we really focused on business development. And that really helped support our prior rebranding and some of the things we did. In the past, early in my career, you did not really do the business development that you see today. So you just kind of waited for work to come in the door. We considered ourselves professionals. We were like doctors and lawyers. I'm not saying that's good or bad, but it was not the same way that you see now. Over the past 3 years, PDG has focused on business development. We've recruited what I think 2 of the best business development people in the healthcare design industry, and I'm just going to see gangbusters from them. They're already making contacts with people that we never made contacts before. And finally, we're in the process of relocating our office. As I mentioned earlier, we see this as a high-profile location that helps support our brand identity and will assist us in recruiting exceptional talent to our firm. Where we're at now is kind of a marginal 70s building. It's fine, it's served us well, but it's time for a change. So why did I go through all that? Well, the basic thing I want you to think about is what you see here is change. You have to be changing. You cannot be a static organization. And we're constantly looking at things, how we can adapt to our industry. Even those things, there's what, 6 things there. Well, I can guarantee you there's twice as many other things that I could have put on the list that are maybe smaller in response. But I think that's a key to having a viable business model for architectural firms. And we've changed how people view us. We are now seen maybe as one of the more innovative and progressive firms doing healthcare design in our region. And I think that's a very good thing for us. Very excited about that. With that, are you waving at me yet, Frank? No. So pro tip number 3, we talked about being nimble and having the ability to make quick decisions, but unless you do something with it, it won't do you any good. And so I think those 2 things go hand in hand with each other in understanding Pulse Design Group. Moving to the next one. Okay, we're going to jump and just talk briefly about COVID-19 because this is something none of us saw coming, and at least I didn't. And but I think it's good to talk about because you may be faced with a similar challenge that we were recently, and maybe this will help you in your field later on. When the pandemic hit, it really challenged us as leaders on how we were going to respond. None of us had ever taken a class called Effective Business Response for the Pandemic World. It didn't exist, at least as far as I know. Now, I guarantee you it does exist now, but at the time, we weren't prepared, and we actually were quite lucky in that some of our business practices that I talked about earlier helped us through this time period. So as a smaller firm, the economic impact of sending everybody home and basically closing the office can be devastating, both to the firm, but also to our staff. We were all worried, especially those first 2 to 3 weeks. We did probably what all the other design firms did during that time period. We were working from home, and we were trying to figure out how we could continue to do our work remotely and what our new policies and procedures were to protect our clients and our staff. So we started with 4 basic guiding principles: protect our staff, keep the firm financially viable, keep everyone employed, and support our clients in any way we could. So let's see how we did. We've had 0 cases of COVID at Pulse Design Group, and that's a reflection of our staff. They bought into it. They practice safe, social distancing and everything else. We have remained financially viable, and we actually did much better than we anticipated. We didn't let anybody go or furlough anybody, so everybody stayed employed. And we honored all our intern and our new hire commitments. I will say this, and it's not everybody's got to do what they got to do, but a lot of our competition and other firms here in Kansas City just closed up shop, let a lot of people go or furloughed them, and it was very sad. And we had a lot of students calling us if we, could take them on for internships, and it was sad. We could not, but at least we were in a place where we could help out the way we could. We assisted our clients in their response to the pandemic. And this included, we did a lot of quick layouts for modifying gyms and classroom spaces into open patient ward type situations. Another project was modifying an ambulance garage into a COVID testing facility, developing drive-through COVID testing solutions. So we were out there in the field coming up with designs very quickly, like the garage modification. That was done over 3 days on a weekend. And it was very intense, but they wanted to be ready to go Monday morning to bring patients through to test. As of 2 months ago, we are all back in the office, but still working in masks and social distancing. We have very strict rules about isolating yourself from at home if you might have been exposed. And approximately 50% of our client and staff meetings are still done virtually. And do I like that? No, but it is a have to. Many of our clients require it. It does make, I think, collaboration and design very difficult, but we're working through it and we're learning as we go. So we'll do what we need to do. You remember we were talking about the 3 things about our firm, and so how did that help in our response to COVID? So our smaller firm size allowed us to do quick responses. I mean, we had most of our responses ready in a week or 2, and we could get back to our clients. Our conservative business practices had us in a very good financial situation even before the pandemic, and kept us whole throughout. And our previous strategic business decision put us in an excellent place to work from. For example, we had an emphasis on acquiring new technology was one of the things, and that meant almost everyone in our office already had a laptop to facilitate working from home. So we really didn't have a giant scramble to get new laptops and things like that. We purchased some software. We had some learning to do, but it all helped supported our response. So the next thing is, what's our lessons that we learned? And number one, you need to really have a contingency plan in place, and not just for a pandemic. It really needs for a variety of things. So you need to think of things like bad weather or power outages. Let's say a tornado came through and wiped out your office. Cybersecurity and malware type events. Those can be super crippling and just take down a firm in less than a day. And it's very frustrating. You can't see where it's coming from. You don't know anything. All you know is you can't work. And so any event that would have a potential to disrupt normal business operations, you need to have a plan in place on what you're going to do. Now, it needs to be dynamic. If something happens, you respond to the events in place, but that's something to keep in mind. Use a quality virtual conferencing system and have it uploaded to all the computers. Make certain everyone knows how to use it properly. And we had a learning curve in our office, mainly me, because I'm probably one of the oldest here. But we got through it, and we're all doing pretty good with it. The next item is important because the firm is only as good as the staff. So we connected with our staff often. You need to have periodic virtual office meetings. Keep it fun and light. It was very depressing at the beginning of this. And remember, we're all social animals. We all need that feeling of belonging to something. And over time, we noticed that some of our staff members were becoming more removed from the team, and you need to capture them back in. I mean, we would have virtual happy hours and other things like that, trying to bring everybody back together. It's important. And then the next item, be open and honest with staff. This was new for everyone, so it was okay to admit that we were concerned, but it's also okay to tell them that we're going to work through this together. And I think they appreciated that. Having their buy-in is critical to resolving this. And then finally, the discussion that we've had previously, collaboration and design meetings are critical to the design process, and they're very hard to do remotely. Why? Why, my staff asked me, why can't we all work from home and stay at home? Well, when you present or you have meetings, as far as the design process goes, a critical part of that is the communication process. And what we all do is have diverse nonverbal visual cues that we all give off during a meeting or when we're discussing something. Those are entirely lost when we're doing it virtually. I can't tell, I've got a classroom full of people that are supposedly listening to me, but you're probably playing with your dog or doing something else, and I wouldn't blame you. But regardless, I can't get that feedback. When we present to a client in person or a user group, I am constantly scanning the meeting attendees for clues on how they are receiving the information. It is typically easy to tell when they are confused, don't agree with you, disengaged. And so if that happens, we can respond to it right then and there and resolve the issue. It's just real difficult doing it this way. And so I don't know that we will ever have collaboration, true design collaboration virtually. At least
Rick, you have the tyranny of being the last speaker here. We've been going it's all very interesting, but I want to make sure we've got enough time for some questions and answers. So
sure.
If you could kind of get done in the next couple of minutes, I want to make sure we've got some time for the students if they've got questions. I apologize.
Absolutely. No problem. I can wrap up real quickly here. Here's a good pro tip though. If you're texting or on Twitter during a virtual meeting, always place your phone at the same level with the camera on your computer. This makes it look like you're actually paying attention.
Students have already figured that out.
Yeah, I'm sure they have, but some of my clients haven't. So the future of architecture, and basically this is kind of focused on post-design group, but it would apply to any smaller or medium-sized firm. Remain innovative. The role of architecture is changed, and actually both Phil and Heather did a great job of discussing that, and that was part of what I was going to talk about. And then the size of the firm is changing too, and for better or for worse. Let's see if there's anything. For us, we're going to continue to become more innovative and adapt to the needs of our clients. We're incorporating the Lean Six Sigma and evidence-based design. I won't go into any detail there, but if you're going into healthcare design, you might look into both of those elements because they're becoming the buzzword for healthcare design. Another thing is the leveraging of new technology, and that was touched on a little bit, but real quickly, in the healthcare area, what we're going to be seeing is smart buildings, and this is a carryover from BIM and everything else. Things like interactive signage that respond to patient or visitors' needs, facility management tools such as light bulbs and that inform staff when they need to be changed, and then real-time building responses to medical events. So quickly, code blue, when they pull the code blue button on a patient, the room actually has responses. The lights go up. It's going to be dumping a lot of air into the room because a lot of people are running towards that room to help with that patient. And so you need all these things that maybe the door unlocks or opens to make it easy for them to come in. They're pushing equipment when they come. So to have that, the building actually respond to an event is great. Data integration between BIM models and databases. Won't go into any detail on that, but that we need to see more of that as we go through. Where are we at? Before Frank pulls me. Yeah, it would be nice to go through this, but your role as the architect is changing, and people are coming into your role and taking away bits and pieces of that. And I think you just need to be aware of that and respond. And the role of business development. The next one is a good one. Be nice to everyone. They may be your source for your next project, and that is true. So I tell our staff, the contractors, the developer, the client, our industry partners, all these people are potential sources now for your next project. It has really changed since the beginning when I started architecture. Firm sizes are going to be changing. 75% of all firms consist of 10 architects or less, and we're seeing, just like in banks and hospitals, acquisition of smaller firms by larger firms. And that trend will continue in the future. So with that, basically, I just want to say, if you're not passionate about architecture now, you really need to find something that you're passionate about in your life. It makes all the difference in the world. It's the difference between having to work every day and having to go to something that you enjoy. So thank you very much, and we'll get on to questions.
Well, that was fabulous. I just again wish we were all together so we could all give you all three speakers a huge applause for your presentations. They were really excellent. We want to make sure there's time for any student questions that may come up. I have a few questions too. So Hui, I don't know if you want to moderate the question and answer session.
So let me pull up the question here. So I think I saw the question from Rachel asking about the future of Lean design and how does the technology might change the importance of Lean design or highlight the importance of Lean design.
Yeah, and I was going to jump in on this one because I've just written a number of things about Lean, and just again, some of the students may not be familiar with it, so I'm just trying to do a 25-word or less description. This is a way to approach problem solving that evolved from the Toyota Automobile Corporation when they were trying to compete against the big three American producers. They had to learn how to be more efficient to be able to to produce a high quality product at a lower cost. So much of their analysis of problems focuses on the issue of waste in terms of how to eliminate waste. And they have a number of rules. There's sort of 7 fundamental rules about things you need to be looking at in terms of any process to eliminate waste. They may say, does an activity add value? Does an activity create weighting, which is a waste in their point of view? I think the key question that's emerged over the COVID crisis is one of the fundamentals of lean analysis is oversupply, overstocking. And so there was, in the healthcare industry, there was a great deal of emphasis on just-in-time supply systems. I think the failure of thinking through that logic is that Toyota does not have to respond to unanticipated surges. They don't have to take a call tomorrow that says you're going to have 3 times to produce 3 times as many cars as you produced yesterday. And so I think what we have found is on the supply side and the inventory and just-in-time systems in healthcare, we've had some problems there. But I think there's still great value in the lean way to look at problems, and we just need to be a little bit more sensitive to what's unique about healthcare compared to the normal manufacturing process. So Phil and Heather and Richard, I don't know if you want to add anything in or challenge me on that.
No, I would just say I definitely agree with you on the healthcare side. I always thought that the opportunity of lean to kind of eliminate a lot of the redundancy or work that's often repeated in healthcare, to provide bandwidth so that they can respond to things that are emergent or not expected, is an opportunity for lean. But we've actually also found that as the technology and transparency around data that we collect around our building processes are getting more advanced, there's opportunities to make that waste that is inherent in the building process more visible. And so actually on the Van Ness and Gary project, the contractor had used this whole method of tax system to actually move through the building and actually, in terms of the trades, align the trades so that they are always constantly flowing on every floor. So every trade was actually active on the site in different parts of the building. And that was really only able to be orchestrated through a technology that was actually tracking their productivity and their movement through the building. And I can just imagine that would only get better with more technology.
Go ahead, Wei. I'm sorry.
Yeah, I was very impressed with all the talks. And I think one key thing, maybe I'm asking for our students, that we see the changes are happening, and technology is making the change even faster. And the pandemic is another factor that trigger us to rethink. So for our students, what do they do to prepare for the new practice, for the new model of architecture? I think Phil, you did that very interesting poll, and majority of our students are not sure whether they're ready for the new model. And Heather, you mentioned your MBA background and how you use that to rethink about the firm communication, the team organization. And Rick, you talked about how the human side, the soft skill, and how important that for the success of future architect and architecture firms. So could you please elaborate on that and help our students to be better prepared for the future?
That's a pretty big question, I think. I don't think there is the new model. I think if there's anything that's interesting about where the profession is going, it's going to be a multiplicity of models that are going to be created by different ways that people are going to choose to serve problems, different talents that people are going to bring to the practice, and the different kinds of conditions that are happening. I mean, I don't think there's much question of this COVID thing. Many of you are practicing the skills you're going to need during the crisis right now, because it's hard. We've been struggling as educators to decide what the implications are of all this remote learning. But at least in architecture, the entire profession is operating remotely right now. But Rick's practice is very much an exception to the rule. Most practices that I'm aware of are in almost 100% remote mode. So learning to collaborate in this way is, I think, is important. And also, frankly, it allows you to think about one of those alternative practice models is, a virtualized firm. Maybe firms don't need physical locations in the future. You guys have different skill sets than us older people do. You're going to be wired in different ways. You may find yourselves able to collaborate or form firms that operate in completely different modalities. And that's what I give some thought to.
One of the things about collaboration that we've talked about in here, and it's because we're so invested in virtual reality, is the potential of walking through the models or through the buildings virtually with our clients. And we're together, we're talking in real time together and going through it room by room. And we're getting feedback from the client. And maybe we're even changing that model. We reach out and move a door down, or we touch the wall and change the color right while he is there with us and moving through it. And that is one way we thought, okay, in a pandemic situation, when we have, all of our BIM models are completely vetted out for virtual reality. And I tease my staff, I say, someday I'll come in and you're all going to be waving your arms around with headsets on, and you're going to be in your own designs making modifications. I don't know if I really want to see that or not, but it has the potential to be there. And in a pandemic situation, it may not be a bad idea.
Yeah, I would also underline, the whole working through Zoom. We have actually found that it's very interesting as a kind of interface in terms of an equalizing factor. Essentially, when people would go into a room, there was a natural kind of hierarchy where people would kind of input, and there was kind of traditional voices that were never heard. And now with the Zoom interface, it's been kind of interesting to hear other people kind of now find the platform to be able to speak up or talk or collaborate. But at the same time, it's kind of taken away, just as Rick was saying, some tools that some of us have really relied on. And so we've been kind of actually having a whole series within our office every other Wednesday, where we have actually like presentation tools around Zoom, where we're constantly sharing tips on, and for me, it's about breaking that fourth wall. Like, we're all standing in front of a screen, and this is exactly the mode that you sit in front of a TV where you watch things passively. So how do you actually break that fourth wall and engage people on the other side? And so there's tools and techniques or ways to talk and communicate that enhance that. And it's been really fascinating to kind of share them.
No, I'll say that I spoke earlier this week to the leadership of one of Heather's competitor firms that shall remain nameless. And they said that they had been pleasantly surprised with how much more efficient they are, how much more thinking time people have, how much less time is spent doing non-lean activities like waiting for people to show up for meetings and commuting. And there are certain advantages to this virtualized world now. He said, I think the problem is that as a professional, we tend to think of these things as binaries. It's like either we're integrated or we're not. We're using BIM or we're not. We're all remote or we're not. It's actually not quite that stark. And we'll learn from this and absorb the things that really work well, and abandon the things that are problematic. You may decide, Rick, that there's an advantage to being able to hire anybody in the entire country right now, as opposed to people who just want to move to Kansas City. And then you might just want to, you have a good airport and nice restaurants, fly them in every couple of weeks so they can meet their colleagues, but they may want to live in Boise or Seattle. So there are advantages and disadvantages.
Yeah.
We have two more questions in the list. So the other question is about firms are slow to adapt to changes. What do you think the solution might be to encourage change in traditional practice firms? Are they at loss once the automation takes over?
I would say, and this is a blunt statement, it's going to be change or die. You have to be very responsive to the change and new technologies that are coming out and new ways of practicing. And while today, you know, we're working in the firm, although we do have some people who still work remotely because of various, we've had one thing that we've noticed about the pandemic, we've had a lot of births from our staff. So a lot of people are on maternity leave and things like that. So that did change, but it's all good. And we've worked around it. And that's the great thing about it. The other thing is, for our clients, you need to think of yourself as a problem solver. You need to go and see the problem and help define the problem and help with the solution. And that's what they're really asking us for. You're a problem solver and you're a communicator. You know, those are the two basic things that I see the role of architects for the future.
Well, I see we're on 2 o'clock now, and this has just been such an incredible set of speakers, and we're getting good questions. I'm wondering if our speakers wouldn't mind, there are a few more questions. What we'd like to do is perhaps send those to you and get a response that we can post if you're okay with that. But I want to thank you all. This has been an exceptional, probably this has been the best grand rounds we've had this semester, and I think it's been very stimulating, good things to think about. And I hope it's been of value to our students. So Hui and Kent, I don't know if you have any additional comments.
I just want to echo that. Thank you so much for such a great speech and also very inspiring for all of our students. Thank you for your time.
Yeah.
Thank you.
Thank you.
All right.
Thanks, everybody.
Thank
Good
you.
luck.
Happy to participate.
Bye.
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 Bye. Rick, I apologize. We had to put pressure on you there a little bit.
Sorry, Rick.
That's
You're
okay.
like you were the anchor man.